Very good morning. I am Dr SANJIV Sharma. I am a senior consultant interventional cardiologist at Batra Hospital, New Delhi. And today morning we'll be discussing a very exciting topic, that is the renal denervation, renal artery denervation, basically for control of blood pressure. So what is renal denervation, which we are going to discuss? It is a novel non-pharmacological intervention that involves a catheter-based ablation of the sympathetic nerves within the renal artery wall. In the past decade, renal denervation has emerged as a potential therapeutic option for patients with resistant hypertension. The strategy of the procedure is to maximize nerve disruption by applying 4 to 6 ablation treatment to each renal artery. RDN reduces sympathetic activity both locally in the kidney as well as systematically, which in turn reduces renal activity and decreases blood pressure. European Society of Council on Hypertension and European Association of Percutaneous Cardiovascular Intervention released the 2023 consensus statement on clinical use of renal denervation in the management of hypertension in adults earlier this year. In 2023, European Society of Hypertension guidelines endorsed by European Renal Association and International Society of Hypertension was released at the recently concluded European Society of Hypertension meeting in Milan. The new guidelines have upgraded as a class 2 recommendations for renal denervation as a treatment option in patients who have an eGFR of more than 40 ml and who has uncontrolled blood pressure despite the use of antihypertensive drug combination therapy. However, it's very important. It also states that the renal denervation should be performed only in experienced and specialized centers that have established a multidisciplinary team with a structured pathway for evaluating hypertensive patients. It's very important. Why RDN went into disrepute 2 years back? Probably the operators were not really trained, and that's why the results were suboptimal, and that's why it did not become popular at that time. I can say that as of now, the indication is resistant hypertension. Probably, I think once it becomes successful, the time is not far when it can be used even as a primary strategy, so that specifically for Indian patients who are too hesitant to start on medical treatment. And I think we have exciting times, and probably RDN is going to play a major role in the management of hypertension patients. I think that's all for me today morning.